Okay. Oops. Quick stop. 1 second. Okay, let me try that one more time for my share screen. Okay, here we go. Okay. All right. So right now, I believe you are looking at compassion in action with the hands. Yep.
Yes.
Okay, perfect. All right. So when I am in presenters mode, I just wanted to give you folks a heads up. Feel free to unmute if you had a question. I may not see the chat right away until I move things around. Okay. All right, so we'll go ahead and get started. And I just want to welcome you to Compassion in Action. And this training is really about how do we support our patrons who might be suffering from a mental health as well as a substance use diagnosis. So to get started, I definitely want to, oops. Okay, get started by an acknowledgement. So I would like to acknowledge the Hawaii Substance Use Professional Development for providing us this opportunity to have this training. This is going to be an interactive training, so there might be, again, opportunity for you to go ahead and enter something into the chat. I might call on someone, ask for a volunteer to read certain aspects, and we're going to also have some questions and answers as well. And at the last 30 minutes of our time together, the goal is that we will be able to participate in some actual hands-on activities too. Okay. At the end of the training, and I think I'm going to leave this to Gina because I know some of you are going to leave at 1 o'clock, some of you are going to leave at 1:30. So it might be to our advantage if we go ahead and get the link sent out at the 1 o'clock. And the link is basically just an evaluation, and your feedback is critical in terms of helping us understand more of what you want to see. It'll also help us to recognize whether or not this training was effective for you. And as importantly, too, it'll provide me with feedback as a trainer in areas that I can improve upon as well. So by the time we're done with our time together, there are going to be 5 specific objectives that I'd like you to be able to walk away with. Okay. The first is just understanding the challenges faced by individuals with mental health as well as substance use diagnoses. Recognizing how stigma and the lack of resources affect patron behavior. Also, to be able to reflect on ways that these challenges might appear in the library setting. The second objective is to learn effective communication as well as de escalation skills. I'd like to be able to highlight the role of librarians in fostering a welcoming environment, as well as equip participants with the practical tools to be able to handle challenges in the process. Our third goal is to gain awareness of the local resources as well as referral options. And I want to be clear that I know your role is primarily as a librarian. Your role is not to be the social worker, the case manager. Sometimes just having those resources and having knowledge that they exist might be an opportunity to be able to share that with the patrons as a resource for them as well. Okay. And then I also like you to be able to understand the importance of self-care as well as setting those boundaries within the setting of the library. Okay. The goal would be to emphasize on the need for being able to maintain. Let me know if the chat, please let me know in the chat if you need. Okay. All right. Emphasize the need for maintaining mental as well as emotional well-being. Also, to be able to encourage strategies for being able to balance empathy with professional boundaries. Encourage you to be able to think about these experiences with your patrons who might benefit from the skills. And then also to just stress the goal of empowering librarians to feel confident and prepared to be able to support their patrons effectively while also preserving your own well-being. Okay. All right. Okay. So I just want to present this screen just for us to start thinking about this because words have power. Okay. So, language plays a very powerful role in shaping perceptions as well as attitudes towards individuals with mental health diagnoses and substance use disorders. Now, the way that we talk about these individuals can either perpetuate the stigma and um, also create sort of this discrimination or maybe even promote rather than promote understanding, respect, as well as inclusivity. Okay, so the words we choose, the way we say it can have a significant impact. Okay, so let's kind of look at the shaping of public perception. The way that we talk about mental health and substance use disorders influences societal attitudes. So, positive, non stigmatizing language can definitely help challenge the stereotypes as well as the misconceptions, thus fostering a culture of acceptance and inclusion. Okay. It also helps us to reduce the stigma. Oops, excuse me. It reduce the stigma. Now, when we talk about reducing the stigma, by using person first language, using phrases like a person with a mental health condition or even an individual in recovery emphasizes the person before the condition. And this basically reinforces their humanity and individuality rather than reducing them to a diagnosis. Okay? So we want to avoid labels. Terms like addict, junkie, or maybe even mentally ill can be stigmatizing and dehumanizing. So instead, words like person with a substance use disorder or individuals experiencing mental health challenges can help shift the focus to their experience rather than their identity. Okay? Fostering compassion through promoting empathy and understanding. Thoughtful language fosters empathy by acknowledging the challenges that the individual faces without judgment. Words that frame conditions as treatable, such as a person in recovery or even working through sobriety, creates a sense of hope and understanding. Encouraging help seeking. Now, stigmatizing language can also discourage people from seeking the help that they need, as they might feel fearful because they'll be judged or they might feel shame. So, inclusive and supportive language will normalize these experiences, making the individual feel safe and validated enough to be able to access resources. Okay? And then creating a safe space. When professionals, peers, and communities use respectful and compassionate language, they create environments where the individuals feel supported, valued, as well as respected. This inclusivity can lead to better engagement in treatment, recovery, as well as overall well being. So, if I may ask for 3 volunteers to each read one of these examples that we have on the slide. Don't be shy. Anybody?
I can read one. Can you hear
Thank you
me?
so much. Yep,
All
I
right.
can hear
So,
you loud and clear.
sure. Instead of there's a schizophrenic, say they have schizophrenia.
Thank you. Can I get another
Mhm.
volunteer, please?
Can you hear me?
I can.
Okay. Instead of they're a drug abuser, say they are living with a substance use disorder.
Thank you. And one last volunteer, please.
I can jump in. So instead of
Wonderful.
saying they're clean now, say they are in recovery.
Perfect. Okay. So, in short, language is a tool that can either reinforce barriers or it can break them down. By being intentional and compassionate in our choice of words, we contribute to a culture of acceptance, and we also create a supportive environment that basically uplifts those with mental health diagnoses as well as substance abuse disorders. Okay, so to kind of normalize this, what I'd like us to do is, look at the prevalence. Okay, so when we think about mental health disorders, basically it refers to conditions that are affecting an individual's emotional, psychological, as well as their social well-being. Such illnesses might be anxiety, depression, bipolar, schizophrenia. Okay. Substance use disorders involve the overuse of drugs or alcohol that leads to significant impairment or distress. Okay. So let's look at the prevalence to really normalize and to contextualize the issue. So approximately 1 in 5 adults in the U.S. experience a mental health illness each year. Now, I work with adolescents, and I know for the most part, many of you are coming into contact with the adult population. As an adolescent provider, I just wanted to add in there too that it starts at an early age. So approximately 1 in 6 U.S. youth aged 6 to 17 will experience a mental health disorder each year. That brings us to about 20 million people have a substance use diagnosis. 1 out of every 22 adolescents meet the criteria for a substance use disorder. So many individuals might also face both simultaneously, and we refer to this as a co-occurring condition or disorder. Okay, that brings us to approximately 35% of adults with a mental health diagnosis or disorder also experience a substance use diagnosis as well. So, studies estimate that among the adolescents that are diagnosed with a substance use disorder, approximately 60 to 75% of them also have a co-occurring mental health condition as well. Okay. So when we think about these numbers, right, it just brings us to the realization that mental illness and substance use problems is not exclusive to a certain population, certain people, so certain socioeconomic status, that anybody's vulnerable to these illnesses. Okay. And for some people, they are more at risk just because of the genetics involved in the environment and so forth. Okay. So, stigma can prevent the individuals, as I mentioned earlier, from seeking the help that they need. At the libraries, the librarians can definitely serve as not only a safe place and a safe person to be able to talk and assist these individuals, but it's also a place where we can start to reduce the stigma and promote inclusion. So what we're going to do next is we're going to engage in just a fun activity, and I have about 10 specific situations, and these situations are going to explore the following. We're going to look at, are these assumptions? Are these stereotypes? Is this a discrimination? Or is this a myth about mental health and substance use? Okay, so the first thing I'm going to do is I'm going to show a statement. So let me go ahead and model that. Okay, so here's our statement that people with mental health or substance use diagnosis are dangerous or unpredictable. Then the idea is this a myth? Is this a stereotype? Is this discrimination? So you go ahead and just drop it in the chat what you think it is, and then I'll go ahead and click on what we call it. Okay. I'm looking at the chat. Okay, nice. Love it. Love it. Appreciate your folks' participation. Perfect. Okay, so it does appear to be a stereotype. We labeled it as a myth. And then here's why. Okay, that in fact, most individuals with a mental health as well as a substance use disorder are nonviolent, and they're also They're not violent or they're not unpredictable. So, in other words, when we're observing their behaviors, sometimes we can kind of predict what the outcome might be, which is why it can help us to sort of be more proactive in nature. Okay. And how I say this in terms of a myth is what we recognize about it is that people with a mental health or substance use diagnosis is definitely not dangerous, and they are definitely more times than not predictable. Now, this stereotype can also lead to, again, fear and stigma. Research shows, in fact, that most individuals with mental health or substance use diagnoses are not dangerous or unpredictable, that the vast majority of them are more likely to be victims of violence rather than perpetrators. So, behaviors sometimes associated with mental health or substance use may appear unpredictable due to the challenges that the individual might be facing in managing their symptoms, but they are not inherently dangerous. Education and empathy are key to being able to reduce the stigma as well as helping us to be able to understand their experiences. Okay. All right. Next one. Okay, can somebody read this one for us?
I'll go. Mental health disorders and SUD are signs of weakness or poor character.
Okay. All right. So go ahead and drop in the chat what you think this is. Is this an assumption, stereotype, discrimination? Okay. All right. And let's reveal. Okay. So we indicated it as an assumption because, in fact, mental health and substance use disorders are medical conditions which are influenced by genetics, biological, as well as environmental factors. They require professional treatment and support, just like physical illnesses. Okay. All right. Next one, real quick. People with co-occurring disorders cannot recover. Okay. So this we see definitely as a stereotype. So when in fact, recovery is possible with integrated treatment that addresses both mental health as well as substance use disorders. And in fact, many individuals actually lead fulfilling lives with the proper support. Okay, our next one real quick. So what we're doing is we're just examining that there are definitely stereotypes, discrimination, myths out there, right? But the more knowledge we have about it, the better equipped we are with being able to be effective with helping these populations. Okay. So the next one is substance use is always a choice, and people can stop using if they really want to. Okay. So this is focusing more on willpower. So we see this as a myth. And reason being is because addiction is a chronic brain disease that basically alters the brain functioning, right? Affecting impulse control as well as decision making. Thereby, treatment is essential for recovery. Okay, so it's literally having a medical condition in that way. Okay, our next one, as we coming to the tail end, is seeking help is a sign of weakness, right? And I'm going to say that's definitely a myth. And the reason why is because seeking help actually requires strength for that person to take that first step towards recovery. It's where they're acknowledging, it's where they're realizing that they need help, right? Okay. Next one. Okay. So people with mental health or substance use are lazy or unmotivated. Okay, definitely a stigma. Individuals with these disorders often face significant barriers such as stigma, trauma, or even lack of access to resources, which can make recovery more challenging. Motivation varies based on individual circumstances as well as needs. All right. Most mental health conditions and substance use diagnoses or disorders are treatable. And we see this as a fact because therapy, medication, and support can significantly improve the quality of life for these particular individuals. Okay. All right. One last one, and we're moving on. And this one is going to be centered around only people from low income or minority groups experience mental health or substance use issues. Okay. So when we look at this statement, we see it as discrimination because when it comes to mental health and substance use, it does not discriminate against, right? That in fact, anybody is susceptible or at risk. So mental health and substance use disorders affect people from all socioeconomic status, racial, as well as cultural backgrounds. However, marginalized groups often face additional barriers to accessing treatment. Okay. Okay. So, why have all this knowledge and why even go over this? Well, it's because this gives us a chance to recognize what is our kuleana, right? So, kuleana in Hawaiian basically means our responsibility. So, it's our duty then, right, to be able to recognize what our part is in terms of do we stop discrimination? Do we do we help others, whether it be the community at large, ourselves, our family? But it's got to start somewhere. And in all honesty, it starts with us, right? So the more knowledge we have about these concepts and how these individuals that you are coming into contact with, those that have maybe some active hallucination, those that might be smelling like alcohol and are sleeping in the chairs in the library, right? It's just being able to fully understand and recognize so that perhaps it gives us a sense of empathy and then just positive regards towards these individuals so that we can be successful with helping them. Okay. So this brings us to again just recognizing that we have the power to stop stigma. The thing is, though, we should do it all together. Okay. And then these are just the ways in which we can stop, just the labeling. We talked about, again, first person, changing language, not assuming, making stereotypes, recognizing social norms as well as cultural values, seeing that there's also the power differential as well. Okay. So when we think about media representation, for example, it's media will often perpetuate stigma through sensationalizing or maybe even just inaccurate portraits of individuals with certain traits or behaviors. Okay. We see this in movies or maybe even news stories that depict individuals with mental illness as violent, can also reinforce the fear and discrimination. Okay. When we think of fear and misunderstanding, for example, the lack of knowledge. So ignorance about certain conditions or groups fosters those fears and stigma. Okay. So an example would be in around the 1980s, right? When we were learning about HIV AIDS, there was a stigma that arose from widespread fear and misinformation about transmission. Okay. And then the last thing I'd like to mention is just around the reinforcement through language. Again, harmful words and labels is just a form of stigmatizing. Okay. All right. So now as we move forward, this gives us a chance to kind of focus on what are the challenges faced by individuals with mental health. Okay. So symptoms and manifestation, for example, occurs when individuals with mental health diagnoses often experience symptoms such as feeling anxious, their heart starts to palpitate, depression. They're feeling depressed or they have mood swings. Perhaps they might be paranoid or even have some cognitive impairments. These symptoms can impact their ability to focus, interact socially, as well as process information. So, for example, someone with anxiety may avoid crowded library spaces, right? Or someone with depression may appear disengaged or even unmotivated when asked questions. Perhaps those with psychotic disorders may struggle when disorganized thinking or may even appear to be talking to themselves due to the auditory hallucinations that they see. Right. So these are just the typical signs and symptoms that we might see or encounter with folks with mental health diagnoses. Okay. I also shared earlier that a person with anxiety may not necessarily visit the library. Sometimes it's counter because the library might be actually a safe haven for them. It takes them out of the elements. It allows them access to the restrooms, being in a comfortable air-conditioned space as well. What you might see though is they might be trying to seclude themselves or isolate themselves as opposed to being in the general vicinity where others are. Okay. Stigma and discrimination. Okay. So again, stigma refers to the negative stereotypes as well as the societal judgments about individuals based on their mental health or substance use diagnosis. This stigma can result in discrimination, exclusion, and diminished self-worth for that individuals that are affected. Okay. Now, when we talk about stigma, there's all types of stigma. Okay, there's public stigma, which is basically the negative attitudes or beliefs that are held by society. For example, assuming that someone with a substance disorder is dangerous or irresponsible. We also have self-stigma. This is that internalizing shame or guilt that individuals feel due to societal judgment. An example I can give you is someone with depression might feel that they are weak or unworthy of help because they cannot just snap out of it. Okay. There's also structural stigma, and these are based on policies or systems that limit access to opportunities or resources for people with these types of conditions. For example, housing restrictions, or maybe even barriers to employment due to a history of substance use. Okay. So, what is the impact then of stigma on our library patrons? Well, many of the individuals avoid the public places like the libraries because of fear of judgment or exclusion. For patrons who are experiencing stigma, simple tasks like asking for help at the reference desk can feel overwhelming as they fear being labeled or maybe even dismissed. A lack of understanding by others, including whether it be library staff or maybe even other patrons, can lead to subtle or overt acts of discrimination such as impatience, avoidance, or maybe again stereotyping. Okay. So how can libraries then address some of this stigma? Well, you folks are doing it, having trainings like this, right? So training staff to be able to use respectful person first language that we talked about earlier. Also promoting that inclusive policies that ensure that all patrons are treated with dignity and respect, regardless of their appearance, behavior, or even their condition. Sometimes a patron who might witness maybe a dialogue that's going on between a librarian and an individual suffering from one of these conditions, they might feel like, well, why are they here? Why do you let them stay here? And really the reason is because it's a public library and it's open to and available to everyone. Right? The only difference is that this particular individual might need an added support and guidance. So sometimes it comes in terms of how the librarians can help address the stigma. It might be even just displaying informational material about mental health and substance use recovery to kind of normalize these challenges as well as foster awareness. Right. And I don't know what your setup is, and maybe somebody can share and chime in terms of like, like some places where you go, they'll have like a magazine rack or a brochure rack that people can pick information out. Are those things available in the library still these days?
I think
Like I
some
said,
libraries have them and some don't. It just
okay,
depends.
okay, gotcha. Okay. All right. So I'm not sure if it's something that you are able to have, especially if you recognize some of the patrons are repeat visitors in that way. So often when that is the case, it really gives you an opportunity to build a relationship with them, right? By just simply saying, "Hi, good morning. Hey, my name's Mary. What's your name?" Right? We start by just that simple introduction. And then as we get to know them, we start to learn more about them. And then it might give us an opportunity to be able to use that as a resource, like helping them find a particular book, right, that they might be looking for because they know that something's going on. They're hearing these voices and they just don't know how to control it. And so, in conjunction with maybe leading them to a book about hallucinations and understanding schizophrenia, etc., you might be able to slip them an informational about what schizophrenia is, or maybe even where to get help with that, doctors, etc. Okay. All right. Let me get back to my slide. Okay, here we go. All right. And then the last thing that I kind of wanted to focus on too is recognizing that individuals, right? We talked about the percentage, and it's more than 35% of individuals who have a diagnosis of a mental health condition also have a diagnosis of substance use. And often the reason why they might co-occur is because the substance use helps them to cope with the depression. It helps them to cope with their anxiety. It kind of takes the edge off of that. And then, of course, it leads into abuse, dependency, and so forth, right? It's an unhealthy way to manage the mental health symptoms. Okay. So let's talk a little bit before we move on. Let's just talk a little bit about the role that libraries can play in terms of bridging the gaps, right? So libraries, again, can provide up-to-date directories of local services such as crises hotlines, free clinics, housing programs, etc. Also, just the technology access. I'm not sure if the libraries are able to offer, printing, free internet access so that, again, the patrons can be able to search for and apply for services, whether it be Medicaid or even just looking for some local treatment programs. Okay. Another way is just the compassionate guidance. And so assisting patrons in navigating complex online systems, as well as finding just help and support, all without judgment. And so it's really about that compassion towards the individual. Okay. All right. So takeaway for this particular slide is just three things in particular. Stigma and discrimination remain significant barriers that isolate individuals with mental health and substance use disorders. And so libraries can combat this through inclusive policies and awareness campaigns. Two, difficulty accessing care, so which often stems from whether it be financial, geographical, or maybe even systemic barriers. So libraries can bridge this gap by providing information through technology access as well as compassionate guidance. And then with co-occurring disorders, when that's present, there's unique challenges just due to the complexity. And libraries can support affected patrons by offering a safe, understanding space and promoting integrated care resources. And so it might be where you might encourage an individual to kind of move off to a different section where they won't be stared at, they won't be judged, where they might feel a little bit more safe, where not all eyes are on them as well. All right. So as we move on, now that we talked about some mental health challenges, a little bit co-occurring conditions, now I'm going to talk specifically about substance use. Okay. So some of the symptoms and manifestations of the substance use disorders might often involve compulsive behaviors where the individuals feel unable to stop using despite negative consequences. Symptoms include mood swings, irritability, or even appearing disoriented, which can be misunderstood by others as intentional or disruptive behavior. So patrons with substance use diagnoses may also struggle to focus on tasks or even meet deadlines, as the substance use often interferes with their cognitive functioning, such as memory and attention. Okay, so some physical health issues. So many of the individuals with substance use experience chronic physical health problems such as liver disease, cardiovascular issues, or maybe even just the weakening of their immune system due to the wear and tear of the substances in their body. Also, some physical symptoms. You might witness tremors, fatigue, or maybe even poor hygiene can also impact how they might navigate public spaces, particularly libraries. And then for some, experiencing withdrawal symptoms can also cause visible discomfort, making it harder for them to be able to engage with the library staff or maybe even engage with the resources that are available to them. Okay, so some of these conditions, like I believe I think they said that EFOS had naltrexone at all the libraries. So in the event a person is overdosing, being able to provide them with care and then calling emergency. One of the thoughts that I had behind this whole concept is probably having perhaps someone in the medical field to be able to come in, because there's always going to be bodily fluids also, right? When a person might be, let's say they were drinking and they had more than they should have, and so now they're vomiting, or maybe even having a hard time in terms of perhaps urinating. So all of those kinds of bodily fluids too can also put not only the librarian at risk, but also the other patrons as well. So kind of figuring out, like, how do we, in a very humane way, be able to assist a person in that state, right? So one is having them work to clean up after themselves. And I don't know how successful this is going to be, but I feel like as long as we are having a calm, quiet, respectful conversation with them, that perhaps they might be more able to engage, right? To keep in mind that you never want to reach out and touch them, especially without, asking for permission. And then just being careful, like if that is the case, perhaps bringing them disinfectant, bringing them paper towels so that they can clean up after themselves. Because in some ways, too, this shows them also that they have the decency and dignity within themselves to be able to take care of that as well, right? Because they don't want to be or continue to be at risk of being judged for things like that. Okay. So I think it was Becky who spoke to me, and one of the things that I wanted to just put out there, sorry, changing topic a little bit, is to for you folks, because you are frontline and you know what it is that you're coming into contact with, to be able to share like what other types of trainings that you would like. Because my thought again is having a nurse come in, a psychiatric nurse come in, to be able to give you folks some guidance and support as well, or even just understanding what does that referral process look like, right? What do they have to go to? And then being able to perhaps understand, well, that's why people don't access it, is because it's so complicated that they don't have the cognitive strength or cognitive abilities to be able to get through that system, that maybe they need a case manager first to be able to help them navigate those things, right? So just food for thought in that arena, in terms of what more that you folks would want to be able to learn that could better equip you to assist your patrons at the library. Okay. All right. So back to our slide. We talked about some of just the physical challenges in terms of, liver disease, those kinds of things, tremors, etc. Tremors will often require a 911 phone call. In that way, poor hygiene is very low on the ladder compared to someone who might be experiencing DTs or convulsions, and so forth. Okay, so in those kinds of situations, right off the bat that you need to call 911. Ideally, that you'll have another staff member present that can kind of guard and watch over that particular area and deflect others, from being in that vicinity, to again maintain the dignity of this individual, and then to be able to allow quick access to the individual that is in need. Okay. There's also going to be legal financial difficulties also, right? Individuals with substance use may face legal challenges due to prior arrests or maybe even ongoing court cases, which might add stress as well as reduce access to stable housing and employment. Financial difficulties stemming from substance use often leaves individuals unable to pay fines. So this might be a conversation that might come up with an individual who's wanting to check out a book maybe, and they can't because they have library due a fine already on record, right? And so recognizing again that with these individuals, there are definitely some of those challenges and complications, and trying to figure out what can I do within the scope of what the state allows. What can I do in terms of meeting this individual's needs within those boundaries and within those parameters. Because it might be, well, I will just have to have a conversation with them to say, I'm so sorry, as much as I would like to be able to allow you to take a book, because I'm sure you can learn a lot from this, I'm going to have you actually enjoy the book sitting on that table, reading it here. Okay. If they're able to get free copies somehow or so, is maybe just copying a few pages that they want to know specifically about in that book, as opposed to then letting them, attempt to check out the book and then having this then repercussion kind of conversation after the fact because they can't. And so problem solving or being proactive can be very helpful too. Okay. And then also recognizing the social isolations. Substance use often strains the relationships with families and friends, which then leads to loneliness as well as isolation. So patrons might use the library as a social place, seeking connection, or maybe even simply just wanting to be around others. Ways in which the libraries can, again, their role in bridging the gap is just through being warm, welcoming, non-judgmental, and providing that space where the patrons feel valued regardless of their challenges. Perhaps even serve as a bridge to essential resources by providing, again, the access to the internet, printed material, or even connection to some local services. And then another way that libraries can bridge that gap is to promote understanding, and again, reducing that stigma through staff training and then just awareness types of campaigns. So together, librarians can make a difference, right, by understanding the challenges that their patrons face and then also responding with empathy, patience, and actionable support. Libraries can be a lifeline for those in need. Okay. So this gives us, now that we kind of talked about why it's difficult and just the stigma and the stereotypes around it, it hopefully gave us an opportunity for us to do some self-reflection, to be able to see what is my part in that and what can I change about that. Now that I have a little bit more knowledge that they're not violent, they're not unpredictable, that maybe I might feel a little bit more safe having these conversations, or feeling more open to being a support to them in that way too. Okay. Then we talked about just the barriers that are associated specifically with mental health and with substance use. So now what we're going to do is we're going to talk a little bit more of what probably will be the most applicable for you, is communication. So what does effective communication look like? Okay. All right. So when we talk about effective communication, first and foremost, it's that active listening. Okay. I'm sure we've been in conversations before with others, and we know that they hear us, but are they really listening to us, right? Do they really get it? Do they understand? Okay. So active listening is fully concentrating. It's where we understand, we're able to respond. And then important too is we remember what the other person is saying. Okay. So we use verbal cues in terms of I see, go on. Can you tell me more about that? Okay. So this shows that we are involved, we are engaged, and that we are genuinely interested, right? Active listening also requires us to be able to paraphrase or even summarize what the person is saying, right? And this confirms understanding. And it might sound as simple as, so you're feeling overwhelmed with this situation. Okay. So let me give you an example of what an effective communication would sound like. And it sounds something to the effect of, it sounds like you're frustrated because you've tried to set boundaries, but they aren't being respected, right? Ineffective communication is interrupting or offering solutions before they even finish speaking. Okay. So, what we want to be sure to do is we want to be sure that we're showing empathy and respect. And we do that by showing that we understand. And we show that we understand by validating the other person's feelings. We don't have to agree with them, right? It's just that if I hear you correctly, you're feeling very frustrated or you're feeling overwhelmed at this point. Okay. And by validating the other person's feelings, while also, again, keep in mind, treating them with dignity. And we treat them with dignity by not being sarcastic about it or rubbing their feeling in their face in that way. But it's really about this is how you're feeling and treating them with that respect and dignity. Right. I'm a firm believer in treat others the way that you want to be treated, right? And so if we can perpetuate sort of that loving compassion, kindness, and sometimes I know it's not easy. Sometimes it's sort of like the fourth person that you're having contact with now, and it's like it can get very overwhelming. Right. And this is where, again, you got to remember to take care of yourself. It might mean calling a supervisor in, might be calling another person in. It might mean you have to just remove yourself from the situation and take a short break to just regather yourself, as opposed to force yourself into it and then try hard and struggle with it and then inadvertently having a negative impact on that interaction with the individual. Okay. All right. So when we show some empathy and respect, it's saying things like, I hear that you're really hurt by what happened. That must have been really difficult for you. Okay. And then part of that effective listening also means avoiding judgmental language, right? So we want to refrain from words or phrases that could make the person feel criticized or shamed. So we want to use neutral as well as objective language instead of accusatory or blaming words. Like, I saw you take it, you took it, you put it there. Okay. Um, Effective conversation might sound something to the effect of, can we explore what happened and think about what might work better next time? Ineffective is that you always do this. Why can't you just get it together? Right. So that's very judgmental in that way. And this isn't something that's easy to do, right? It takes practice to be able to get to that place where it becomes natural and it kind of rolls off of your tongue in that way. I'm not sure if you folks are familiar with MI and the context of MI, and it works really well with folks with substance use diagnoses. And it's really about the spirit of MI, and it's that compassion, it's that partnership, it's that collaboration. And some people have it and they naturally have it and they practice. Some people don't have it, but when they practice it and they really start to believe in it and speak it and allow it to take root in themselves, then people experience that, right? And when you have that spirit, people are more inclined to be collaborative, cooperative, rather than combative or confrontational. Okay. So perhaps that's something you folks might want to learn in the future in terms of using MI in those kinds of situations. And it's called motivational interviewing. All right. So what we're going to do real quick then is, because we talked about the importance of effective communication, we're just going to quick watch a video on that, and I hope you folks can all hear it. So let's go ahead and start. So the 4 actions of active communication. Anybody hearing it?
I'm not hearing it.
Okay. Okay. Here's what we need to, let me quick stop. Okay, and then share screen. Okay, here we go. Sound optimize. Okay, and there we go.
In a world full of distractions and noise, being a good listener is a powerful skill that can foster deeper understanding, empathy, and connection with others. Here are 4 actions active listeners use to validate the speaker. Number 1, give undivided attention. Active listeners give undivided attention to the speaker. Set aside your phone. Avoid multitasking and maintain eye contact so the speaker feels genuinely cared for and valued. Also, encouraging nods and mirroring gestures express empathy and understanding. Number 2, have patience and trust. Interrupting breaks the flow of conversation and signals disregard for the speaker, while active listening helps them feel important and comfortable sharing their ideas. Be patient with their pain and love them up to you instead of worrying down to them by having faith in their abilities. Number 3, ask thoughtful questions. Active listeners ask thoughtful questions, demonstrating interest and compassion. After repeating key points, open-ended questions encourage the speaker to elaborate. Compassion and curiosity helps them know that you care about them and their entire story. Number 4, provide feedback if asked. Worrying about the speaker often leads friends to give advice, but this centers their fear, decentering the speaker and their emotions. Speakers mostly want to feel seen and understood rather than fixed. Unsolicited advice can feel invalidating and may cause the speaker to shut down or become defensive. Luckily, having an active listener like you to bounce their thoughts off of will help them process the situation and come up with their own options for a response. At this point, they may ask for your thoughts. Brainstorming response options together is a non-judgmental way to generate ideas and confidence in what they can do next. Plus, it helps the speaker feel that their plight is worthy of your energy and attention. The validating effects of active listening are powerfully healing, making you feel good about yourself and your relationships. Being an active listener is a rare and valuable expression of love.
Okay. All right. So I know that this might seem just so simplistic. Like, I know that. I know about active communication, and I know what should be done. I think it's just important for us to revisit it, only because sometimes it's just so much easier doing it with our loved ones, with a friend, or with individuals that we work with, are close with. But sometimes we don't realize that this can go a long way too with folks that might be very different from us, or folks that we might be struggling with in the moment, and might even be frustrated with them in the moment, that it's natural for our human nature to come out and not appear as supportive as we would really want to be. Okay. All right. back. Oops. Okay. All right. So then the next point of conversation is going to be focused on sort of what are the best practices when we're talking about effective communication. Okay. Out of this. Escape. Okay. Oh, let me share screen one more time. Sorry about that. Here we go. Slide. Okay. All right. So here we just have sort of like, well, what can we do when we are practicing effective communication, right? And it's maintaining that calm tone. And often you might feel like, well, they're yelling at me, right? So the best way to de-escalate a conversation like that is to respond in a soft tone and maintain that soft tone, because the goal would be to do that mirroring where we'll want them to then drop their level down with us. And if that doesn't work, that might mean, can we take it outside here, right? Can we talk on this side, because we don't want to be a distraction to the others that are here also. Or it might be, I want to be sure to respect you and I don't want others to hear your business. So maybe if we can come out on this side, it might be helpful for us to have the conversation there. Okay. All right. Other things to keep in mind, again, just speaking calmly when addressing, especially if there's a disagreement that's going on, always just retain that calmness and then use clear and simple language, right? So in many of these cases, our patrons that are suffering from mental health and substance use, the cognitive abilities may not all be there, right? Does that mean that the person who might finally sober up can focus at that point and be able to remember and retain information or things that you're sharing with them. But while they're under the influence, it's going to be in vain. So it's really more about the safety, your safety, the patron's safety, and then the individual safety as well. And it might mean, again, escorting them to maybe the tree right outside of the library or something where they can actually sleep rather than trying to sleep on the chairs in the library in that way. Right. And then you can always say, so, you can be out in nature right now as you kind of sober up a little. And then when you're ready and you're feeling able, then you're more than welcome to come back in and check out some of these resources. Okay. All right. Okay, so when we think about conversations and communications, right, there are definitely going to be some do's and don'ts that will work. So right off the bat, some of the things that you definitely want to do is you just want to stay calm. So use a steady tone of voice and maintain open, non-threatening body language. Next is just acknowledge their feelings. Say something like, I can see that you're feeling unsettled. You're safe here. Right? Or maybe even focus on the present. So gently redirect their attention to the immediate situation. It might sound like, let's focus on finding what you need right now. Okay. Provide them with space. If the patron seems agitated, give them some physical space to feel less cornered. And use that clear and simple language. Avoid overtly complex explanations. Example is, I'm here to help. Let's take one step at a time. Offer options, empower them with choice. Would you like to sit in a quieter area, or would you like to look at some resources together? Okay. Or perhaps even seek assistance if needed. So if the situation escalates, involve a supervisor or another personnel discreetly, while also maintaining that patron's dignity as well. Okay. And some of the don'ts. With do's, there's always going to be don'ts. So some don'ts is, don't dismiss their experience. Avoid saying things like, that's not real, or you're imagining things. Okay. This can feel very invalidating. Don't argue. Resist the urge to challenge their beliefs or perceptions, even if they seem very irrational. Okay. Like if they're hallucinating, okay, it must be hard. Oh, okay. All right. You hear what they're saying? Are you okay? Do you feel safe? Okay. You're not, that's all in your head. You're not hearing anything. Okay. And then two, don't touch them without permission. Physical contact can definitely escalate paranoia or discomfort. And then don't raise your voice. Speaking louder can be interpreted as aggression, and also worsen agitation. Okay. Careful with our language again, so don't use judgmental language. Avoid phrases like, "What's wrong with you?" or "Why are you acting this way?" Okay. Don't corner them. Ensure that they have an exit or enough personal space to avoid feeling trapped. And this is something you want to take into consideration for yourself as well, right? So when you are approaching someone, you want to try to be in an open area. You want to go off at an angle as opposed to coming directly at them where they might feel it's more confrontational, right? Because when you're at an angle, they feel like they got space around that they can access, if they need to, or if they're feeling unsafe. Okay. And then don't ignore the escalating behavior. If the situation becomes unsafe, calmly call for assistance, while also prioritizing everyone's safety. Okay. All right. So I know several of you are going to be, okay, I got 9 of you left. Awesome. Thank you so much. I appreciate your tenacity. Okay. So next we're going to be kind of talking about de-escalation skills. Okay. So we're going to see this. Let me make sure. Let me quick stop sharing. Okay. And then maybe if you folks can kind of share with me, you can either drop it in the chat, like what has your experiences been like, and perhaps what's the biggest challenge that you encounter?
I work in an academic library, and I think the two challenges that we deal with are people who have anxiety would be one of them. We have a lot of students who are suffering from anxiety, and then and the other thing is we have some patrons who are seem to have paranoia or be kind of hostile.
Mhm.
So those are at least in our academic library, those are the kinds of things that we've experienced.
Mhm. Okay. Okay. So just off the bat, and I will get to this towards the tail end. So especially for those individuals that are experiencing anxiety, sometimes just getting them to do a grounding activity can help. And that's like a 5, 4, 3, 2, 1. And that is, one, you get them first to take a deep breath. And you want to do this with them too. So they take that deep breath, and then you say, okay, so now what I'd like you to do is I'd like you to just look around, and what are 5 things that you can see? So the idea is to bring them back to their senses. So it's going to be see, touch, taste, smell. Okay. And we'll talk a little bit more about that, but that can definitely help, for those with anxiety. For the paranoia, especially those that are hostile, for sure, using a calm, low voice. And then even asking them in terms of, what would make them feel safe? How can I help you feel safe in this way? Because also, I'm sure our human nature when we're trying to de-escalate situations like this or address individual that is feeling paranoid and feeling hostile is it's natural to have that flight response instead, because I'm like, I'm scared. Is this being effective? What does that look like? So when you try to fix yourself up in the proximity, again, you want to be sure that you have easy access to be able to get away. And then talking to them in a calm way. And then when you're talking to them, and this is might take every ounce of your being, is in terms of just being in the moment with them, right? Because in our minds, we know that, okay, that's not really what's going on, but that's their reality. And we can't argue with that because it's only going to escalate things. But it might be, well, what is that voice saying to you? Like, is that voice making you scared? right? And then you'll know, like, okay, if they're feeling scared, is okay, what can we do to help you feel safe? Would coming out here make you feel safer? Would it be sitting on the chair, not looking at others in the library? Will that help you feel safer in that way too? Okay. All right. So now what we're going to do is I kind of wanted to talk about the de-escalating skills. So we're going to watch a short video again on
This
9 ways
video
to
will cover 9
de-escalate.
de-escalation skills for dealing with patrons. Please review these skills periodically in order to incorporate them into your daily behaviors and your approach to dealing with patrons. Be empathetic and non-judgmental. This is part of our customer service. Try to understand their feelings. Remember that whatever a patron is dealing with, the problem is important to them. For example, you might say, "Thank you for your patience while we sort this out," or "I'm sorry you're having a bad experience at the library." Respect personal space. Allowing personal space can decrease a person's anxiety and provide staff with a little safety buffer. Allow at least 3 feet distance. Provide confidential space by stepping away from busy service points, and try to avoid enclosed spaces like offices. Use non-threatening body language. Body language communicates more than words in the best of circumstances. If a person is upset, they hear your words less. Keep your gestures, facial expressions, movements, and tone of voice calm. Stand to the side rather than facing the patron. It's less confrontational and allows you to sidestep away more easily. Do not touch patrons and never shake or point your finger. If a patron is using a loud voice, lower yours rather than attempting to shout over them. It might not be appropriate to smile. If someone's upset, they may feel that you're not taking them seriously. Be professional and rational. Remain calm. You can't control the patron's behavior. You can control your own. If you are calm, professional, empathetic, and are taking their problem seriously, their need to escalate can be reduced. Focus on feelings. Right now, how the patron is feeling is more important than the facts. Listen and watch their body language carefully. Empathetic and supportive comments can be helpful, like, "It sounds like you are frustrated." Ignore challenging questions. Don't argue. Avoid a power struggle. Don't get drawn into "you librarians always do this to me" kinds of accusations. Focus on listening to allow the patron to calm down and allow you time to think of a resolution to the situation. Set limits. If a patron's behavior is belligerent, defensive, or disruptive, give them clear, simple, and enforceable limits. Offer concise and respectful choices and consequences. Remember, the code of conduct exists for all. Choose wisely what you insist upon. Many of the library's policies are negotiable. Offer the patron options that might serve them better. There are no absolutes. Our goal is to maintain a welcoming atmosphere for all our patrons. If the patron you are assisting is negatively impacting other patrons' enjoyment of the library, for example, they're yelling profanity and do not respond to your requests to stop, you can and should ask them to change their behavior or leave for the day. Allow for time and silence. Give the patron the opportunity to reflect on what's happening and how they need to proceed. It's okay to do that 10 count in your head and allow the patron time to calm and focus on the situation. Remember, our goal is to find the balance that provides a safe, pleasant environment to all our library users. Please continue to the next portion of this training.
Okay. And then I wanted to quick jump to the slide. Okay. Here we go. Okay. Okay. So again, the importance with the de-escalation is trying to remain as calm as possible, giving space and setting those clear boundaries. Like they said, I think that might be very important, especially with those that are getting hostile and paranoid in that way, is to say that, you know, I'm here to help you. Right now, it doesn't seem like it's working. So I'm going to ask you to leave, and you're always welcome to come back tomorrow. Okay. So simple conversation like that with them. Okay. So what I wanted to show you folks next is what kind of resources do you folks have for the patrons? Do you folks actually give them resources to say, hey, you might want to check out this clinic, or you know, schedule an appointment at the counselor's office? What does that look like for you folks? So it looks like perhaps that's not an option for you, that you folks don't
Oh,
normally do that.
I think it, you know, if it's students, like if those of us who work in academic libraries with students, we would refer them to, um, you know, the campus, I
Counseling
forget what it's
center.
called, but you know, like the mental health
Mhm.
help situation. But when it's, you know, members of the general public, I don't think we usually ever refer them any place.
Okay. 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 All right. So after we're all done today, there are going to be some resources that are available that might work for the general public. I'm not sure, you know, if it'll get to that point, but at least you'll have some tools in your toolbox that you could potentially assist them with, or even to some of the students that are on campus as well, because they might tell you, I've been there, it doesn't work, they're not helping me, kind of thing. And so, well, here's another option for you. Okay. So the other thing too, as we wrap up, is I wanted to be sure to talk about self-care. Okay. So let me quick get back to that. Okay. Okay. So some of the important things is that this can definitely result in a lot of emotional depletion. And because sometimes it's, you know, we think about it after the fact, right? One, we're in the moment, and it takes a lot in us. It takes a lot of mental energy, mental power, a lot of hope within us to deal with the situation. And then we're always wanting to make sure that we deal with it the best way we can, which often comes after the fact when we're thinking about it and we're kind of either decompressing, maybe we're processing it with someone, we're talking it out with others, and then we keep thinking about it, right? We keep talking about it. So sometimes the benefit of that is the talking and the debriefing kind of helps us get to a point where we can release it, right? It's kind of like it's taken out from the internal and brought out into the external in that way. So there's definitely some power in that conversation. But sometimes too, when we ruminate over it, it becomes even more challenging, that oftentimes that can even lead to burnout as well. Okay. And this is why it's so important for us to be sure that we find that balance, and we want to be engaging in self-care. Repeated exposure to these kinds of challenging and stressful, interactions can definitely lead to emotional exhaustion. And so, you know, when we're addressing the needs of the patrons who have mental health as well as substance use challenges, often requires, again, that emotional labor from us, which can deplete our energy if we don't manage it, right? So think of it as a cup. If you keep pouring, pouring, pouring out and you don't refill that cup, then you won't have anything more to to give in that way. So then all the other contacts that you have for sure are not going to be as effective because you're not at your optimum at that point. So proactive self-care definitely helps to maintain emotional resiliency as well as prevents feelings of helplessness or maybe even detachment from our work. We want to at the same time, so aside from preventing burnout in that way, we also want to be sure to enhance our job satisfaction, right? So feeling supported, having strategies. Sorry. Okay, so feeling supported in that way, and also having strategies to be able to manage that stress can also make that interaction with our patrons definitely more manageable and as well as rewarding too. Okay. When we prioritize self-care, we're more likely to view our role as impactful and meaningful. And then a well-cared for librarian is better able to connect positively with their patrons as well as their colleagues as well. Okay. So another thing along with self-care is definitely improving personal well-being. Your health and happiness definitely will affect your ability to be present and empathetic. Chronic stress can also lead to physical symptoms, and it might manifest in things like headaches, feeling fatigue, or maybe even having difficult sleeping. And this can ultimately also add strain to personal relationships too, right? So regular self-care promotes mental, emotional, as well as physical wellness, which can definitely help you to thrive both at work as well in your own personal life. Okay, so when we think of self-care, what is one thing, and if you could just drop it in the chat, what is one thing that you do to manage your well-being? Perfect. Wonderful. Okay. And that's important. We always have to be sure that we have something that we're doing to take care of ourselves. And then in the mix of that too, what's going to be important is being able to set those boundaries as well in the library, right? So clearly defining your role, being consistent in your approach, and also just using respectful yet firm language when setting those limits. Like if you have to have a patron removed, while you're telling them to lower their voice, is just again setting clear boundaries, so that they understand what it is that you're asking them. And sometimes you might feel like I'm talking, and they don't get it. It might mean you got to change your language, or you can even just check for understanding. So, Frank, can you tell me what you just heard me say? Okay, because Frank might be just too in his head right now that he's not hearing anything that's coming out of our mouths. Okay, all right. Okay, so these were some practice ones in terms of some of the role plays. So here's just an example of how to deal with a agitated patron. Okay, so here we have the patron who is visibly distressed, speaking loudly about hearing voices, and of course impacting others nearby. Right. So a dialogue that a librarian might start off with is, "Hi, I notice you're feeling a bit upset. Is there something I can do to help?" The patron says, "They won't stop talking to me and I can't make them go away. That sounds really difficult. Let's find a quieter place where we can talk more comfortably." If the patron agrees, then you can escort them to a private place, offer water, and then listen briefly. If they refuse, then you might respond, and this is again part of that boundaries. "I understand that you're upset and I want to help. We do need to keep this area quiet for others. So can I help you find someone to talk to who might understand what you're going through?" Okay. So that's just one example of how we could de-escalate or address our patron who might be hearing voices, so the active hallucinations, and how to meet his needs. Okay. The other one that I wanted to share with you was the grounding activity. So with the grounding activity, again, this is perfect for individuals with the anxiety, right? So let me quick pull that up. Okay, I must have taken that out, but let me grab it off my computer just so that I can show you folks, because this has been proven to be effective as well. Okay. So it's called a grounding technique, very common for use with, again, anxiety. And this can also help with the individual who is hearing voices or just stuck in their head, so to speak. So grounding. It's called the 5, 4, 3, 2, 1 technique. Okay. I'm just going to show you a screenshot of what that looks like. So let me close this. Okay. Let me quit just share. Okay. It's bigger. My computer's just running a little slow right now. So when we look at this technique, it's basically name 5 things that you can see. Are you able to see my screen?
Yes.
Okay, perfect.
But it's like the right-hand side of it, there's a box that needs to be closed.
Okay, there we go. And then, okay. Okay, here we go. Okay, that made it even worse. So let me move back to, okay, here we go. So we've got the 5, 4, 3, 2, 1. So you can easily have them say, okay, you know what, why don't we do this together? And then say, let's just take a deep breath. You take a deep breath. So it's a nice belly breath. And then you breathe in through your nose, exhale through your mouth. And then say, okay, so I want you to kind of look for 5 things that you can see. So they'll look around and you'll have them name it, call it out. What are 4 things that you can feel? Okay. 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. Okay. And then you close it up with the deep breathing, deep breath again. And the reason why this is so effective is because then it gets them to kind of get out of focusing on what is triggering them or making them anxious. And now they have to focus on the here and now and be present and be observant in terms of what's going on around them. And this is all connected to their senses. So that's something that I would highly recommend, especially if you're having individuals that are anxious. And this is a tool that they can easily use anywhere they at, right? And you can have them write it down, or you can even maybe just print it and give it as a small little card for them to be able to reference and utilize. Okay. So there's those pieces. I would have loved for us to have more time to kind of actually break out into breakout groups to practice the dialogue in that way. So maybe something that we can do in the future. So there should be an evaluation form. And I know Becky really wanted to hear from you folks in terms of like what other types of trainings that you folks wanted. When she talked about the defecating in the library and things like that, my only recommendation was getting the paper towel, a safe cleaner, and having them clean up, because those are kinds of bodily fluids that we need to be careful about. And I don't know if you folks have bodily fluid kits in the library, like we have in our treatment centers, right? That you can even offer them a pair of gloves too as they clean up after themselves and so forth. But I do think having, individuals from even the medical field come in, whether it be from your full school of medicine, that can talk about those things in terms of how to handle things like that, especially an alcoholic who might be a person with alcoholism, excuse me, that might be actively having withdrawals in that way too, is, how do you manage that? And unfortunately, the library is a go-to place for many individuals, even if they may not need it. And that's because it's a place of refuge. It's a quiet place. It's a safe place for them to be. And sometimes they feel it's a place where they can go where nobody's going to bother them either, too. Okay. Any thoughts, questions?
Well, I just want to thank you so much. This has been an outstanding training, and if maybe we can connect together offline about getting the recording, because I know a lot of people had to drop off early and didn't get to stay for the whole thing. But I definitely hope that people will send in their thoughts about additional trainings that they would like to have, because like you said, I think some of that role playing would be really helpful for people, or even an opportunity for people to bring their own issues that they have in their libraries and get some advice about how to approach them would probably be helpful, because everybody's issues are a little bit different. And public library issues are probably somewhat different from those of us who work in academic libraries or even school libraries. So, but this was really, really wonderful. Thank you so much.
You're very welcome. It's such a pleasure to meet you folks, and it was such an honor to be here with you folks today. Have a wonderful day. And for sure, Becky has my contact number. In fact, let me just give you my contact information, and this is for all of you, to if ever you have any questions or you just want to reach out. Then that way you're more than welcome to call me, email me, and then my phone number. I'm leaving my phone number too. Okay. So, oops, and that's 808, sorry. So 808-728-4222. Okay. All right. Well, you folks enjoy the rest of your day. It was such a privilege and an honor to be with you folks. Take care.
Thank you.
You're welcome. Bye-bye.
Bye.